So the lower jaw is an arc of closure, and in a normal mouth, it's going to come and hit like this. But if the maxilla is deficient, the teeth are pulled back. And as the jaw goes down, as the jaw goes up, the front teeth hit. So it has to pull backwards. Well, when you pull backwards, the condyles go backwards.
Correct.
When the condyles go backwards, the disc goes forward. When the disc goes forward, it gets in front of the condyles. So when your hygienist is trying to work on a patient and they can barely open their mouth, that's a problem for not only the patient, it's a problem for the dental team.
Welcome to another episode of the Irreplaceable Dental Team. I tell you, I always find the hidden gems, and I have a very special one for you today. But I'm not going to spend time telling you about him. I am going to welcome Dr. Mac Lee. Welcome, Dr. Lee. How are you today?
What an honor to be here. And I've been checking you out, girl, and you are a mover and a shaker. And I like being around movers and shakers. They make me want to do more. It's a good thing.
Thank you very much. Thank you very, very much. So before we get into the meat of anything, why don't you share with my viewers and listeners, just tell us a little bit about who you are. And I know that you have spent a lifetime in dentistry and have a lot to offer, but tell us a little bit about the man, the Mac.
The man. Well, I live in rural Texas. My family's been here for 5 generations, almost 200 years. I'm a 3rd generation dentist. My grandfather was a dentist in the same town, same building. My dad was a dentist, same town, same building. And my brother's a dentist in a different town. So dentistry is definitely in our blood. And I didn't know what I was going to be when I was in high school and college, but I knew my dad had a good job, even though I never went up there. I never worked in the dental office. I didn't know one thing. I did not know mesial from distal. I didn't know anything when I went to dental school. I graduated and came home, a little rural area. For 5 years, I practiced in the Valley of the Shadow of Death of dentistry, doing nothing but junk work, and people wouldn't pay, and et cetera, et cetera, et cetera. And I thought maybe I made a mistake. And in 1977, a long time ago, I went to the Pankey Institute, and it changed my whole entire life, my view of dentistry, of what it could be instead of what I was making it into. It was all on me because I didn't know. But of course, I wasn't educated. I couldn't see all of the things the wonderful things of dentistry and what dentistry could do, not only for my patients, but for me and my family. My dad taught me how to do non-surgical periodontics, which his dad taught him. My grandfather thought that gum disease was a dental infection and that you should treat it as such. And that is to remove all of the bacteria, the barnacles and everything, put antimicrobial agent. This goes back to 1928.
Wow.
And where he would treat a patient every day for a week doing this scenario. And so my dad taught me, and I don't know if you ever heard of a Dr. Earl Estep, and he heard about what I was doing. And so he came down to my office, brought his whole team, brought everybody, and they just sucked all the information out of us that they could. He convinced me to get on the road and start teaching this because nobody knew it. The periodontists were after me. They didn't want me teaching all this, even though they didn't know what I was teaching, because what I was teaching back then is now the standard of care. And what I found was there's some really, really, really good dentists out there doing some unbelievable things treating TMD. And I was really good from Pankey and Dawson. I was really I was good. But I still was not able to take care of 95% of the TMD patients until I learned how to do neuromuscular dentistry.
Okay, so really what you've said is that you've spent a lifetime dedicated to to serving people, serving your colleagues as well as your clients. Kudos to you, Dr. Lee.
That would be true. That would be true.
Well, I stumbled across you because I saw this fabulous book, and I said, I have to find out what this is about. So I went on Amazon and I found it, and I gave you 5 stars.
Good.
It's one of the few books about the temporomandibular joint that is written for the patient as opposed to colleagues to understand and explain what to do, which I think is fabulous. There may be others out there, I've just not come across them. So I was quite intrigued. My first question to you before we speak about this wonderful book is, how do you define TMJ? What exactly is it in your mind?
So it's extremely confusing, as everybody knows. And the most confusing thing about it, when you really break it down, is that you have painful TMD and you have non-painful TMD. Non-painful, I won't spend much time on it, but that's when the teeth break down. That's when things fall apart. That's when the brain is not listening to all the misalignment of the upper and lower jaw and the teeth. And then you have painful TMD. And the pain can be here. It can be in the muscles all over the head. It can be both of them. To make it more complicated, it can be in the fascia. It can be in the ligaments. It can be in everything in the head. And it's all innervated by the trigeminal nerve. And the trigeminal nerve, as you know, is an extremely powerful nerve. And it feeds into the brain. But here's kind of the key, in my opinion, is that the brain is the one that determines whether it's going to be pain or not. That's why it is so mysterious. So when you do a diagnosis, you listen to the patient, HD, I want to hear your story. Well, Dr. Lee, this one I chew is this. Well, there's probably a joint problem. Because when the upper and lower jaw are in disharmony, or the teeth are in disharmony, it creates a problem, just like gears in a car. If the gears in the car are not lined up correctly, bad things are going to happen. In dentistry, there's 3 ways that people have problems with their teeth. 2 are infection, decay, and gum disease. That's the only thing that's taught in dental school. The 3rd way is mechanical, how everything comes together. That's not taught in dental school. Therefore, it's not taught in medical school. Therefore, your ENTs know nothing. Therefore, your neurologists know nothing. So the whole world is unaware of TMD, one of the purposes of the book.
I read through this book and I said, this book is gold. Because not only do you read through it, but it's a reference. You can keep going back to it. And the way it is broken down, it's easy to find what you may be interested in because you break it down so nicely. So
I'll have to give credit to my co-author, Jonathan Fashbaugh, because he would outline things for me and I would sit down and just do a steady stream of consciousness on my computer. And then he did a fabulous job of exactly what you're saying. And I thank Jonathan for that. We make a good pair.
So would you say the purpose of this book is to be a guide for anybody having head and neck pain, unexplained pain that nobody can seem to find what the challenge is or where the source is? Because, TMJ pain, as you've said, can be the mysterious pain that nobody can seem to identify.
It is an invisible pain. And when you did it when you treated TMD patients as long as I did, you heard over and over and over from the patients, why hasn't anybody told me this before? I spoke in Japan, I spoke in Tokyo at the International College of Craniomandibular Orthopedics in May. Mm-hmm. There were 14 different countries there with dentists trained the same as I am. Their patients had the exact same problems as your patients in Jamaica have, is that I had in my little bitty town in Texas.
Yes.
And so if the problems are the same, the solutions are the same. But you got to make it real easy so that people understand.
Right.
And they can understand that when the jaw is trying to find a home and it can't, that you're overworking all these muscles. And that creates pain, but not in everybody. If the brain is not listening, the teeth are going to slam into each other and they're going to break each other out. So a large part of my practice was reconstructing the mouth, but not because they were pain patients, is because the teeth were broken down. Why were the teeth broken down? TMD. And do you know why I retired? I know that you deal with team members, and you know why I retired?
Because your left, right, and center hand retired.
My assistant, who knew everything that I knew, and I only had one assistant and one hygienist in my later years in practice, and we were still doing great because I did big cases. She said, well, I'm having a baby and I'm not coming back. And I say, well, what day is that going to be? Because I'm walking out with you. I wasn't going to go back through training somebody when we were such a fantastic team.
Yes. She was your right hand, your left hand, and everything in between.
Absolutely. Yes.
Oh, my goodness. So this name, TMJ Trifecta, explain to me what you mean by the TMJ Trifecta in a nutshell.
The upper jaw and the lower jaw come together like a door and a door jamb, correct? And the joints are the hinges of the door. If the door jamb is not set straight up and down and not perfect, then when the door closes, the hinges have to change a little bit. So the trifecta is posterior interferences. That's when the door jamb interferes with the door closing. And then a torqued mandible is when the upper and lower jaw are torqued, and so a door can torque. And it depends on how the hinges can move. If they're movable, that you can slide and fit that door in there. Here's what here's the irony of what we're doing. I can explain all this to a patient and they understand. I can explain this to a dentist and they say, but what if? And they have a hard time wrapping their head around the simplicity of what's in that book. They understand posterior interferences because they see it every day. Torqued mandible, they got to think about it a little bit, but when you tell a dentist that the biggest problem is that the maxilla, the upper jaw, did not develop correctly, that's why we have apnea, did not develop correctly, and then the lower jaw can't find its place and it's looking for its place, and it pulls back, and when it pulls back, it compresses the condyles, and when you compress the condyles, you knock the disc off, you create all kinds of problems within that little bitty space where the disc and where the joint is. Not only is the joint compressed, but the throat is compressed, and therefore you have sleep apnea. And it's really, really simple to see that concept if you let past learning get out of the way.
Gotcha.
Now, I know that you deal with apnea by looking at your website. I know that you deal with pain patients. How does the trifecta fit in with what you do? Because here's my other thing. I want the whole world to know about TMD, but I also want dentists who treat TMD a little bit different to be able to communicate with each other and trade ideas and trade knowledge so that we, working together, benefit the patients of the world.
Yes, I don't think any one person knows everything, but I can tell you that I found a very close correlation between adjusting or correcting or supporting an airway that is properly opened and a more comfortably functioning TMJ. Now,
Right.
sometimes it's a matter of opening up the arch so that lower jaw can fit properly and the tongue can move forward, and that space that is compressed back there is not so much so, but that's not always an option. But the primary thing that I find helpful quite a bit of the time is preventing parafunctional habits so that there's not as much pain in the muscles. And that is usually something that helps significantly because the airway is open, the jaw doesn't have to swing in all kinds of directions. And I may not get 99% of the pain to go, but a significant amount of the pain decreases once you take the stress off the jaw to create space for you to breathe properly at night.
That is 100% correct. Now, you use a MAD, right? You use a device that holds the mandible forward. You can't pick up a stick without picking up both ends. You can't move the mandible without moving the condyles. There's no way. So when you come forward, bringing that jaw forward, you're bringing the joint forward.
Correct.
So the number one thing that people have problems in neuromuscular dentistry, they say, oh, well, you always bring the jaw forward and down. A compressed joint is a joint that's too far back in the socket. It's too far back. So what do? You bring it forward to put it in a more neutral position.
Correct.
What does a MAD do? It brings it forward into a more neutral position that decompresses not only the joint, but it decompresses the throat so that the patient can breathe. And because the upper and lower are flat planes, they hit together, they remove the posterior interferences,
Right.
they remove the torch mandible, and they take care of the deficient maxilla, all in one appliance. Problem is, you can't wear the appliance during the daytime. So then you have two appliances, daytime appliance that does the same thing, except the patient has to move the jaw forward instead of being held forward. And it's miraculous what it does for these pain patients. Miraculous.
Yes. So the appliance where they can actually function chewing, swallowing, speaking, because there is a specifically made appliance that every time you close, it's going to help you to close in the forward position.
Yes.
We're on the same page.
Well, it's an arc of closure. Okay,
Right.
so I'm for those who are listening, I'm holding my hand out, but you really need to be able to see this. So the lower jaw is an arc of closure, and in a normal mouth, it's going to come and hit like this. But if the maxilla is deficient, the teeth are pulled back, and as the jaw goes down, as the jaw goes up, the front teeth hit. So it has to pull backwards. Well, when you pull backwards, the condyles go backwards.
Correct.
When the condyles go backwards, the disc goes forward. When the disc goes forward, it gets in front of the condyles. So when your hygienist trying to work on a patient and they can barely open their mouth, that's a problem for not only the patient, it's a problem for the dental team.
Correct.
Range of motion, solve a problem. And so, my thing is SAT, stop and think. You got posterior, you got, anterior where? Why? CSI, crime scene investigation. Why? Well, put your teeth forward. Oh my gosh, they fit perfectly. Lights come on. Well, that's because the maxilla has been pulled back. And that's where the comfort zone is, where the wear patterns hit. It's all very interesting, and it's all very simple once you see it.
So the dental team, not just the dentist, the dental team, what would you want them to know as we're looking at just evaluating patients as they come and go? Because as you've said, some patients will have pain, some patients won't. Most of the time when we have that patient reclined,
Mhm.
It's hard to see clearly what's happening when they're upright, sitting, or standing. The jaw is in two different positions. What would you tell a dental team, the ABCs to look at for any patient coming in before they're even reclined?
That's a great question. When you see the muscles are really acting, they're doing like this, and they're talking, and their jaw is going out like this, you have a potential nightmare. These are the ones that when you work on the teeth, they come back the next day and say, my tooth was okay until you worked on it. Okay, if you don't know occlusion, you're in the, it's bad for the doctor, it's bad for the patient, it's bad for the team. I think that any lower anterior wear is a sign of deficient maxilla.
Correct.
Now, that doesn't mean there's going to be pain.
Mm-hmm.
I think any clicking is common, but it's not right.
Correct.
I think that the patient needs to understand what's causing their clicking. I think the patient needs to be given the opportunity to learn what's going on. I use my team for that. I did not do that myself. I am one of the few dentists that would go into a dental office with a team member and teach their team and the doctor. The doctor had to be there because he can't be better or she can't be better than everybody else. They got to be the same. And we had a patient care coordinator. Guess what? They saw all new patients. They saw all emergency patients while I was working in the mouth. They can talk to the patient better. They can listen to the patient better. They have more time. We would put their pictures up on a big old monitor so that the patient knew what we were talking about and wasn't trying to sell them anything. And my team was everything to me, everything. And that's why I was so successful.
So you hit the nail on the head. That's where I was going. Dental treatment has to be comprehensive in the sense that everybody on the team should understand, even if they're not the ones doing the treatment, they should have a clear understanding of what's happening.
100%.
Now, we're pretty good with that when it comes to perio or dental disease, but when it comes to TMJ, it's a different story. In fact, I have found that some people almost disregard it as something on the outskirts of dentistry.
Well, sure. 90%, at least 90% of the dentists. You can't get a hot dog at a high-end steakhouse. It's not on the menu. Okay, so there are certain things that you do in your practice. When you look in your mouth, you see this, and this is what I require. This is the best thing for this patient. It's called a menu. The team needs to know your menu, including everybody up front. They need to know the menu also. Okay, so if you have a person with a high vault, the palate is shaped like a V instead of a U. They got TMD. If they can't open their mouth very wide, they have TMD. If their joint deviates when they open, they have TMD. If it makes a noise, they have TMJ. If they have abfractions, they have probably non-painful TMD. If they have cracked teeth that are virgin, they have TMD. And the list just goes on and on and on. So teeth come in looking a certain way. Okay, this is a full mouth reconstruction, but this is a nice looking mouth.
Yes, it is.
So when you have one that doesn't look this way or look like yours, which is beautiful, and you have such a beautiful broad, you're filled out, your maxilla is fantastic. When it doesn't come in, my team member would take a picture of that one thing, put it up on the big monitor and say, it didn't come in looking like that. We need to do a little investigation. We need to do some crime scene investigation of why it looks that way. And that makes dentistry fun. When you know how all this operates, you're like, wow. And the ENTs don't have a clue what you're talking about. The neurologists don't have a clue what you're talking about. The book that you showed, and I got my little copy here, I would be so excited if somebody had severe ear pain and went to the ER And the ENT looked in the ear, which is good. It's a good thing. And they said, the ear's clear. I don't see any problem. And the patient would say, well, doc, do you think it's a compressed condyle due to my bite? That would be Valhalla for me. That would be fantastic. So if you educate the patients, they're going to make the MDs, the neurologists, the dentists that don't know what they're doing, they're going to make them tippy toe on their feet. They're going to make them say, man, maybe I'm missing something. That's another purpose for the book.
Yes. I think in today's day, people are more inquisitive. It's no longer whatever you say, doc, just tell me what to do and I'll do it. People are researching, they're reading, they're looking for answers. And so I thought it was such a good idea for you to have a one-stop where somebody could say, you know what, I'm not sure if this is what I have, but I'm going to go through this book and see. Because things are broken down so simply that if you are interested in finding out if your head and neck pain is related to your temporomandibular joint or related to an airway issue that has your temporomandibular joint out of whack, it is very easy to be able to read and think, okay, he may have something here. Let me investigate further. Let me ask my doctor. Let me push forward on my own, because we are in the age now where, unfortunately, we have internet doctors, meaning that people go on the internet and they have the answers to everything. The problem is there are no filters. So you get the good, the bad, and the ugly on the internet. But if there is a place, a source that the average person can go to and say, okay, this guy that wrote this book, he's been doing this for over 50 years. He knows what he's talking about. Let me read it and see. Yes, I can identify myself in these pages. Let me go and seek some attention. If my doctor doesn't know, there must be somebody else that can help me, because at least I have an idea as to what's going on with my body. And I think that you're going to find that once people realize that this is available, people are just going to continue to purchase, because there's so many people seeking answers and they just can't get them, simply because if people can't explain it, they think it's in your head. Right.
Yes. And I really need everybody's help on getting this word out on everything that you said. And I just deeply appreciate everything that you did say, because not only is there a bunch of people on the internet that are not doing right, but there's dentists that are not doing right. And they are at the mercy. The patients are at the mercy of these unaware and or uncaring dentists that only want to rip them off. So you have to protect yourself today. And the only way you can protect yourself is through education. You got to know what's in this book, and somebody tells you something, you say, well, wait a minute, that doesn't make sense. Oh, you need a splint. Well, what do you mean by splint? Oh, well, we need to put plastic between your teeth to keep them from grinding. Well, are you going to have them in harmony? Are you going to have the upper and lower jaw in the right position? Are you going to have the condyle in the right position? How are you going to measure the condyle when you do that for me? It's serious stuff.
So I have a challenge for you, Doc.
Okay.
Nowadays, people are looking to be part of communities. They're looking for places where they can connect and share their experiences with people who have similar experiences. A community where people can hear from experts what's going on. So my hope is that this is the beginning of your community, where you might consider having webinars and all kinds of wonderful things that people can pop on and ask questions and get answers that they haven't been able to have for so long. So my encouragement to you is, let this be the beginning of a community because so many people would like to be able to connect with somebody who truly understands what they're experiencing, who truly understands their pain. So that's my challenge to you, Dr. Mack. What say you?
What say me? Okay, so there is a book called From Strength to Strength, and it's really pretty neat. It's when you start out young and you got a young brain and all the unbelievable, Einstein and everything, they did everything when they were in their 20s. And as you get older and older and older, that brain, instead of becoming fluid, it becomes crystallized. So this is my crystallized part of the book. So I got this down. Now, the lighting here is horrible. I'm looking at myself and say, God, this is horrible. Well, I do my podcast on a different place that I've got that's got better lights. And so the reason I'm telling you this is that I'm not savvy to all the things that are needed. And I'm not disagreeing with you at all. It's just absolutely needed. Now, my co-author, Jonathan, he's the one that's into stuff that you're talking about like this. I'll provide the crystallized knowledge, but I can't provide the fluid knowledge, because when you get to be 80 years old, things change. But yes, you're right. But I need everybody's interest. If they're not interested, why would you do it?
So who's 80 around here?
Pardon?
Who is 80 around here? Listen, it looks like Dr. Mackey uses some kind of youthful serum, because I can't see a wrinkle.
Well, I've been a little fortunate, Anyway, it's here. It's 80 years is here, but I'm very, very, very fortunate and feel great. My wife's the same. We're very healthy and happy.
Well, it's good to see what 80 years young looks like.
There you go.
I am so happy that at this stage, you're still doing things in a different form to serve people, which is what you've done all your life. This is awesome. Well, and I'm so glad I had the opportunity to cross your path, and how generous it was of you to respond to me and come and share with my audience today. We are truly, truly blessed to have you.
Well, thank you very much. So I have been to your country before, but I was on a cruise given the non-surgical perio. I was hired to do that. And we did stop at Jamaica. Beautiful, beautiful.
Oh, you just made a pit stop. That means you need to
I know.
Spend some time by the beach and just sip margaritas or whatever it is that you sip.
All of it.
But before you leave, I have some rapid fire questions for you. Are you ready? We're just going to have a little fun.
Sure.
What's your favorite food?
I would have to say brisket, barbecued brisket.
Okay. A man from Texas. I could see that.
I cook very good brisket.
Okay. Is there one place on your bucket list that you'd love to visit?
I've been very fortunate on that also, but I've traveled quite a bit in my time. I plan to go to France with my son next year, my wife and I. So they're in Paris right now.
Awesome. Now, what would you tell your 16-year-old self at this time? What advice would you tell your 16-year-old self?
To get involved, to study, to learn, to find it, to studying, not to be studying as a job, but to be something that is exciting and it's an opportunity to learn. That's my only regret that I have in college. I wasted it all partying, having those margaritas and sitting on the beach you're talking about. So, yes, and I would like to have it to do that again, and even get involved in politics or whatever it might be, just to learn more about the world. When you live in a little bitty town like I do, or I did in rural, you have no idea what the real world is like. And that is a shame. The whole world needs to understand each other, and we all need to get along. It's just a travesty that all the things that are happening now.
I agree with you, but thanks to technology, you are going to go much further than your feet could take you, and your influence will go.
And that's a good thing.
And your influence will go much, much further than the sound of your voice. And I have one request before we leave today.
Yes.
And that is that you will come back and share with us on another occasion.
I would love to, and then I'll have the lights right and everything else, and I won't look, I really look better than this.
We were focused on what you were saying, and so we're not really even tuned into the lighting being great or not great.
Good.
It was great conversation. We learned a lot, and I'm sure many people are going to pick up your book.
Yes.
Just because it is one of a kind in how it has been created to help the average man solve the puzzle of their head and neck pain. What a very interesting discussion that was with Dr. Mack. So knowledgeable. And when I tell you this book truly has broken it down, so people who've been searching for answers to their unexplained head and neck pain really have a guide to go to. We as the dental team need to recognize that a high palatal vault is not a good thing. It's not a good thing for your airway. It's not a good thing for your joint. We have to recognize that if we see the face looking a certain way, not full, but prolonged, mouth breathers, that too indicates that the airway is not open, the joint is not functioning well. Teeth that are cracking and breaking. Why? It's not just a matter of fixing, but it's also a matter of understanding what's causing it and getting to the source so we don't have to keep rolling over and over and over again. So let's make sure that it's not just about treating the perio, it's not just about restoring the teeth, but it is about looking at the whole patient, the airway, the TMJ joint, whether the patient is having pain or not, and making a difference in the quality of their life. Life is better when we live, learn, and grow together. See you the next time.